similarly smooth. I had these two cases where like most of them FS surgeries are going to be difficult extubation because difficult in the sense a lot of patients coughing, fighting the tube or finding it difficult to breathe through it. Chances of airway spasms, coughs are there. And my patients are like comfortably woke up. There is the blood which is being collected in the sump is always collected through this Vasca mask, so no problem. Yeah, the patient herself is trying to remove the mask by herself. That shows that my anesthetic requirements are very less. I hardly use muscle lax in the surgery. Her muscle power is very good and her recovery is also very good. So she herself removed and sore throat problems are very less. She's able to talk except for the nasal twang. She's able to do that. She just said her nose is blocked. That's the convenient of using supraglottic device for your surgeries. So next you move on to like what is your comparison? What advantages are there with supraglottic device? Apart from your ventilation, the other post-op complications like sore throat, hoarseness of voice, coughing, laryngospasms, all decreased, very low incidence with supraglottic device. But what haunting thing with us is you think of gastric aspiration always. The overall incidence is just 0.009 to 0.02% of aspirations were like identified. So it's very difficult to validate this statement. Is this supraglottic device always successful or managing supraglottic is always successful? No, sometimes you do face problems. Most of the time we'll have leak and poor ventilation with the device. Airway obstructions can occur. Gastric insufflations are possible. Rotation or popping out of the mouth is other problem sometimes. And sometimes you find resistance to insert the nasogastric tube through this device. So we'll troubleshoot each and every problem now. If there is a leak or a poor ventilation, what are the possible causes? It could be an inadequate plane of anesthesia. Most of the time, this is the common problem we face. You try to keep inflating your mask, but you don't think about the plane of anesthesia. Just first think of your plane of anesthesia. Make sure your plane of anesthesia is good. If not, because the laryngeal pharyngeal muscles could contract and displace your supraglottic, the cuff little laterally. So think of your anesthesia, plane of anesthesia first, or it could be of overinflation of your cuff, or it could be mask could be too high. So what you have to do is deepen the plane of anesthesia, limit your cuff pressures to 60 centimeter of water, and if you feel that the mask is too high, so you're getting a leak, try to advance it further and see. What happens if there's a gas leak through your drain tube? It could be the possibility is mask may be too high or the tip could be into the glottis. So what you have to do is like try to advance it further and see if you're getting a very good ventilation. If not, remove it and reinsert. There are lot of maneuvers like up and down maneuver. Other maneuvers like even a part of Chandy's maneuver can just remove it 6 centimeter up and just reinsert it and try to get a very good ventilation. Other possible problem could be occur is airway obstruction. There is difficulty in ventilation. The problems are like tip may be into the glottis or the cuff may be folded medially. So what to do?